KDXU News Time, 9:33, Southern Utah Morning News. Good morning and welcome. It is, well, it's not every other Monday, the fun Mondays of the month when we get to talk once again with Stephanie Parrish, founder and CEO of Vibrant You. I'm Mike McGarry. Good morning, and Stephanie, good morning.
Good morning, Mike. It's a beautiful day in Dixie.
Oh, I'll tell you, we've had some interesting weather.
Haven't we? Keeps us on our toes, right?
But it is looking good out there. I love it. Well, let's see. Well, Vibrant You, great place. More and more people, obviously, Stephanie, are finding out about all the good things that are occurring. So we're here to share a little bit more about those good things.
Absolutely. Thanks, Mike. We just have got the most amazing clients coming in. We have got everything from severe brain trauma to cancers to cerebral palsy to fibromyalgia. In fact, little sideline, one of my fibromyalgia sweet ladies, I've been in there this morning. We are now open at 6 a.m. How crazy is that?
Oh.
So that we can accommodate. And the funny thing is our 6 and 7 o'clock times are like completely booked. It's like, who gets up that early?
Apparently quite a few people.
Quite a few people. They want those new times, and we've extended to the end of the day also a little bit so that we can accommodate the clients that want to come in and make it work for them. But one of my cute little fibromyalgia clients this morning came in, and when she started with me, she's got pain level about 9 every day. Really severe out of 10, and she also has had this chronic cough that she's had for years, and she's been to doctors. Everybody's trying to figure out if it's allergies or what's happening. She's not sure. They don't know. That's probably 80% of the clients we get in there. Most of them, the doctors just don't know, right? They're trying to just shoot from the hip and figure it out. And she came up to me today and she gives me a hug and she goes, Stephanie, I've done 6 sessions today, and my pain level is at a 5, and I haven't coughed for 2 days. First time in years.
Wow.
She hasn't coughed. And she's like, I'm only at 6 treatments. Is that normal? I said, around here, nothing's normal. I said, everybody's bodies are different. So we just love to hear that. So make sure it's documented. We'll document it in our notes so that we can follow your progress with it. I mean, things like that are just amazing for us to be able to hear and be part of that every single day. It's the neatest thing, and that was just kind of a cool lead-in to be able to start talking today. And we've got, like I said, so many people with so many different issues that we have right now. We've got a number of people coming in just to do sauna that are working on just some inflammation and that need some detoxification. Really cool to see that happening too. And then our QRS pad, which is our quantum resonance system pad, we have a few people coming in just to do that as well, and they love it. 8 minutes on there and their bodies just feel like they're totally relaxed and rejuvenated. So using all these different modalities as a commonality together is what makes Vibrant You so different. I have been asked, and I'm going to do a little plug here because I had 2 different people come in from the radio show this last week and say, I had to wait to find out who you were. So I'm going to let you know right now. It's Vibrant You, Hyperbaric Oxygen and Light Center, which you had already said, Mike. Thank you so much. And they can look at our website at vibrantuutah.com. So if you want to come into the clinic, please call first and make an appointment because we love to have the time to talk to you. And the phone number here is 435-218-7260. Again, 435-218-7260. And we have our clinics up in Salt Lake, Murray area, as well as Riverton area in Salt Lake. So you can find that information on our website, vibrantuutah.com. So one of the things that we want to hit this month again, continuing a little bit more because people ask me all the time about the brain. Right? We've talked about the brain, and I've said this so many times in all the different trainings that I've been taking and the different people I've been working with on heal the brain, heal the brain, heal the brain, heal the brain. And you get the brain working and the rest of the body tends to be able to know what to do and to fall into place. So the brain encompasses so much, doesn't it?
Absolutely.
I mean, I was just sitting there thinking of all the different things that we work with, and the majority of them, unless we're dealing with like a ruptured discs or knees that need replaced, that we hopefully they don't need to be replaced.
Yeah.
Or I was just talking to a friend of mine that's having a rotator cuff replaced or surgery, and I'm like,
yeah.
get in and see me first. not that surgeries aren't wonderful and doctors aren't wonderful. We need them and we love them, but we really love to see what the body can naturally do first. So let's see what the body can do, and then whatever's left, the doctors can take care of. That's probably not very good.
Well, you talk about the brain. I think a real classic example was the young man we had in just a couple of weeks ago. And fortunately, not many people get that traumatic of a brain injury,
Goodness.
but it was unbelievable to hear him, his dad, and all those talk
Yeah.
about how. I think the neat thing is that the brain works all by itself most of the time for most people, and so we don't really realize. Then if there's any kind of a problem, then we really realize what we need to help in the brain. Absolutely.
Absolutely. And Jonah Tuttle was awesome, and his
Amen.
dad Tom.
He was.
And we are getting ready to do a kind of a little documentary with them, so people will be able to follow them on the website and do a more in-depth program with them. And Jonah, just a shout out to him, I'm not sure if he's listening, he's actually at my clinic right now. It's been so fun with him because he is just blossoming with this. He's an incredible man anyway, but he's been blossoming and his brain has come back. And for those of you that don't remember, it's a recap. He's the one that was longboarding up at Snow Canyon and at 50 miles an hour and crashed and broke his head in 7 places, his skull.
Right.
Ended up in a coma for 9 months. And he is now able to get his speech back, and his grades are straight A's at the university, and he played rugby for the university up there, and he's now running, which he couldn't even walk a couple months ago. And so it's been just such a pleasure to work with him and see how he is progressing. Oh my goodness. And he knew we were really busy Thursday, and he heard kind of everybody talking how are we going to get everybody in, make sure we got everybody taken care of, make sure that they're feeling the love, make sure that nobody's feeling like it's just going through a conveyor belt getting in, but making sure everybody's getting the attention and the love that they need. And Jonah's like, can I help?
Yeah.
Wow. And he's done this a few times, so we're absolutely go back and let's get him helping. And he's been able to clean and take care of the clients and do the things that we love to do. And he sits there and talks to them and tells them his story. So it's been pretty cool to be able to watch what he's doing. So a couple of the things that we wanted to talk about this week are cerebral palsy and autism. Again, both things affected by the brain, right?
Absolutely.
It's really interesting because we have so many different topics, but the majority of them all come back to the brain. So again, a couple of the things that we want to talk about with cerebral palsy, and in 2 weeks when we come back, we're going to have some families that have children with cerebral palsy that have been coming to us, and they're going to share their stories.
Very good.
Which we're really excited about, because again, I'm one that likes to hear stories. I love to hear stories, I love to tell stories, and I love our listeners to be able to hear the stories. And I can tell stories all day, but when you hear it from the mouth of somebody that's experienced it, there's nothing better. And we get to see really amazing things with cerebral palsy. We've had, I don't even know how many we've had in there, probably 6 or 7 of the 3 years since we've been in here, all different levels. We had a young man come in last year that was 15 years old. He needed help walking. He was non-communicative. Couldn't talk. He would grunt a lot and just kind of babble. And his mother and I sat there and I said, okay, what are your goals? What would you like to see happen? I know you're doing all this therapy and all these different things all the time. And she looked at me with a very solemn face and she said, I just want to hear him talk. I want to hear what his voice sounds like. He's 15. And she said, and I would love to be able to get him potty trained. He's 15. And I said he wasn't in a wheelchair, but he had to have assistance, usually with two of his siblings that would help bring him in, or his mom and a sibling, to bring him in. And it was a challenge, bless his heart. So his mother went in with him, who had very severe fibromyalgia, which was a really cool bonus because she went in as his caregiver, right? And her pain level went from a 7 to 8 down to a 2 to 3.
Wow.
And then we're working with this wonderful young man. He would sit in the chamber and he would play on his little computer and he would look at animals. That was his favorite thing, and he'd grunt with the animals. And after about 10 sessions, he started going, dog, and we could hear him. And we're like, oh my gosh, he's saying it. you know, because the little computer would say it back, and I'm going, is that the computer? Is that him?
Yeah.
You know, and we realized it was him. So he was starting to get his verbal communication was starting to come. And then he had done probably 20 sessions with us. And he got out of the chamber. It was so cute. He got out of the chamber, and his mom got out of the chamber. She has to hold him up. And he was standing there, and he was looking at me, and he goes, "Love you." And I looked at him, and his mom looked at him, and she goes, "Did you just say that?" And he looked at me again right in the eyes, and he goes, "Love you." Of course, we both started bawling.
Yes.
Right? His mom's like, "That's his first words, and he said it to you." Like, well, I'm sure it was overall, but it was just such a tender moment. And she was like, "I've always wondered what his voice sounded like that wasn't garbly or
Right,
you know,
right.
noises." And it was so cool. And from that point on, every time he'd get out of the chamber, he would tell me, "Love you." And then he had done probably about 25 sessions, and he got out and he says, "Love you." And then he got this very concerned look on his face. And he grabbed his stomach and he kind of bent over. And his mom and I looked at him, and his mom's like, what's going on? Are you okay? What's happening? And he just had this terror look on his face, like he didn't know something was happening. And so she goes, "Well, let's go in the bathroom and see if you're okay." So she took him into the bathroom, and a few minutes later she came back out with tears in her eyes. And she said he just wet himself, and he recognized it. For the first time in 15 years, he recognized that his bladder was releasing. He was able to feel the sensation for the first time.
Wow.
You know, and for us, fast forward going through with I'm getting goosebumps thinking about this, and thank you for putting the tissues right in front of me because you know I'm going to need them. He got to about his 40 sessions. Here we go with the tears. He got to his 40 sessions, and he was starting to say about 6 or 7 words. And his mother said that he was able to tell her for the first time that he needed to go to the bathroom, which is the first steps of being potty trained, right? At 15 years old. His little brothers were sitting out there in the hallway or in the waiting room, and one of our other clients asked them, "What have you noticed the most about your brother?" And both of them said, "He's not mean anymore."
Wow.
And he goes, "What do you mean he's not mean?" He goes, "He would get so frustrated because he couldn't communicate that he'd start throwing things, and he'd grunt, and he'd scream at the top of his lungs, and he doesn't do that anymore." This is what these 2 younger brothers were saying, and how he just sits there and plays with a smile. And I was like, oh my goodness. And one of my other clients was hearing this. So I guess this was at about 38 sessions, because he wasn't quite done. He had a few sessions left. And one of my other clients was hearing this. And he took me aside afterwards, and he said, "Does he need more?" I said, "He always needs more. It's cerebral palsy. It's something that's going to take a long, long time." And he goes, "Would you anonymously let me pay for another 20 sessions for them, but don't tell them?" And so when I mean, how gracious is that, right?
Sure.
When I took them aside and explained to him what had happened, she just kept saying, "Who would do that for us? Who would do that for us?" And I said, "An angel. An angel would do that for you."
Yeah.
And by the time he got done, so he had done 60 sessions. By the time he had gotten done with 60 sessions, he was completely potty trained, and he had a 12-word vocabulary.
Wow.